How about Fort St. John?
There are 5 of us here, physiotherapists, occupational therapists, and a dietitian. And we have one question for you.
Please.
Okay. Now, we are sure that we are a level 4 center here, and we are hoping that in the future we'll be able to step this up, that we'll be able to become a level 3. But we are wondering along teleconsulting and teleeducation, are you able to provide us information as to how we can benefit from this or how we can access this?
Yeah, so that's actually one of the 4 projects originally we had thought about, and we're actually looking into it some more. So one of the ways that you can benefit from telerehab, of course, is to be able to consult various disciplines, including physiatry or other perhaps a specific neuro, physio or OT and SLP and so on. And that can be done through the teleconference equipment in the facility, preferably with the patient present. And that can be requested and scheduled on a regular basis so that the technology and administration part can be more streamlined. So that's certainly one way of looking at things. The other way that we can be of assistance is that if somebody is actually returning to your center from a level 1 or 2 rehab team, we can then actually all sit down and have a bit of a team meeting through teleconference to talk about the details in terms of the goals and the expectations and what the person has been doing and what they're expected to do once they go home. And then thirdly, of course, it's a good tool for just educational sessions, such as this one, or having more specific ones related to stroke rehab therapies.
University Hospital of Northern BC and Prince George.
Hi, Diane. It's Rita Sweeney. There's 20 of us in the room. And I'm not sure if they have any questions. Anybody?
Yeah, I'd like to know for Northern Health how, because we've been so minimally involved in the second stage of the collaborative, how is the Ministry of Health recommendation going to impact on the health authorities? That recommendation, the next step to implement some of the collaborative's conclusions for service delivery.
So I can't speak for the Ministry of Health, but I think our hope is that with this framework, then Northern Health will have a look and say that, for example, they may not be able to identify a level 1 or 2 facility, in which case then they would have to decide, is this something that is worthwhile for them to develop rather than sending people out all the time? Or do they want to focus on building more level 3 services? So those are the kinds of decision making that each health authority is going to have to undertake. And certainly, with input from you people on the front lines, to come up with a plan that would work for your region. And the challenge, of course, with Northern Health is geography, as well as, transportation. So that's why the framework is not meant as a prescriptive implementation model. You may need to think about, for example, housing people in affordable places closer to centers that have more services for a few weeks while they're undergoing a level 3 ambulatory stroke program, or something of that nature. And so the hope is that this framework would allow the ministry and the health regions to see how they currently fit in and where they would like to develop their resources.
Hi, this is Prince Rupert. We have 3 people in attendance. We just sort of have a question or a comment around the patients that get left behind that are not considered appropriate for rehab at a level 1 facility. Is there plans on the part of the BC Stroke Rehab strategy to look at the algorithms for them or the strategies for them? Because they will end up staying in those level 3 and 4 facilities, and we need to also find a means of managing their care as well and their continued progress, because they do progress over time.
Right. I couldn't get into the full details of the algorithms during the presentation, but if you have a look at it in the actual framework document, there are built-in loops where patients should be reassessed at intervals of 6 weeks, 3 months, 6 months, so on, even if they wasn't deemed ready or appropriate for a rehab program at the time. And that was meant exactly to pick up this population that are perhaps a bit slow in getting off to a start, and to try and not have them fall through the cracks. Yeah, and once they do become more appropriate, then the referral can then again be made to a level 1 or 2 stroke rehab program.
How about Campbell River Hospital?
Good afternoon. There's 5 of us here, and we were just wondering what the difference between a number 1 and a number 2 would be. Like, we're trying to figure out Victoria, we would think would be a number 1 level. Would Nanaimo be then a number 2 as far as rehab is concerned?
Yeah, so this is the kind of sticky discussions that we get into when we try to pin down the designations. And I think this is something that the facilities in the regions will need to discuss in more detail in terms of who and where they want their level 1 and 2 facilities to be located. Certainly there's nothing, against the rules in having more than one level 2 facility. The big difference is that level 1 is also meant as more of a provincial resource, so you would get referrals not only from your own region, but possibly from other regions that do not have level 1. And also that you are probably more of an academic center where there's more research and educational activities that are going on. You probably would be providing a fair amount of tele-rehab consultation services. So that would be the main difference.
Okay, thank you very much. We do have an active treatment stroke unit upstairs, as well as a stroke TIA outpatient clinic in Campbell River, and the rehab team works very intimately with the nurses. It's working really, really well.